This video is dedicated to how you can lower your blood pressure to normal if you are hypertensive. 1. Increase activity and exercise more. In a 2013 study, sedentary older adults who participated in aerobic exercise training lowered their blood pressure by an average of 3.9% systolic and 4.5% diastolic. These results are as good as some blood pressure medications. As you regularly increase your heart and breathing rates, over time your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lowers your blood pressure. Increasing your activity level can be as simple as using the stairs, walking instead of driving, doing household chores, gardening, going for a bike ride, playing a team sport. Just do it regularly and work up to at least half an hour per day of moderate activity. 2. Lose weight if you're overweight. If you're overweight, losing even 5 to 10 pounds can reduce your blood pressure. Plus, you'll lower your risk for other medical problems. A 2016 review of several studies reported that weight loss diets reduced blood pressure by an average of 3.2 mm Hg diastolic and 4.5 mm Hg systolic. 3. Cut back on sugar and refined carbohydrate. Many scientific studies show that restricting sugar and refined carbohydrates can help you lose weight and lower your blood pressure. A 2010 study compared a low-carb diet to a low-fat diet. The low-fat diet included a diet drug. Both diets produced weight loss, but the low-carb diet was much more effective in lowering blood pressure. 4. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. Potassium is a double winner. It lessens the effects of salt in your system, and also eases tension in your blood vessels. However, diets rich in potassium may be harmful to individuals with kidney disease, so talk to your doctor before increasing your potassium intake. So many foods are naturally high in potassium. Here are a few. Low-fat dairy foods, such as milk and yogurt. Fish. Fruits, such as bananas, apricots, avocados, and oranges. Vegetables, such as sweet potatoes, tomatoes, greens, and spinach. 5. Eat less processed food. Most of the extra salt in your diet comes from processed foods and foods from restaurants, not your salt shaker at home. Popular high-salt items include deli meats, canned soup, pizza, chips, and other processed snacks. Foods labeled low-fat are usually high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. 6. Yoga. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. A 2013 review on yoga and blood pressure found an average blood pressure decrease of 3.62 mm Hg diastolic and 4.17 mm Hg systolic when compared to those who didn't exercise. Studies of yoga practices that included breath control, postures, and meditation were nearly twice as effective as yoga practices that didn't include all three of these elements. 7. Reduce excess stress. There are lots of different ways to successfully relieve stress, so find what works for you. Practice deep breathing, take a walk, read a book, or watch a comedy. Listening to music daily has also been shown to reduce systolic blood pressure. And one small study has shown that acupuncture can lower both systolic and diastolic blood pressure. 8. Stop smoking. Stopping smoking is good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation, and narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels even if you're around secondhand smoke. A study showed that children around secondhand smoke in the home had higher blood pressure than those from non-smoking homes. 9. Eat some dark chocolate. Yes, chocolate lovers, dark chocolate has been shown to lower blood pressure. But the dark chocolate should be 60 to 70% cacao. The benefits are thought to come from the flavonoids present in chocolate with more cocoa solids. The flavonoids help dilate, or widen, your blood vessels. 10. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. For some people, getting a good night's sleep isn't easy. There are many ways to help you get restful sleep. Try setting a regular sleep schedule, spend time relaxing at night, exercise during the day, avoid daytime naps, and make your bedroom comfortable. The National Sleep Heart Health Study found that regularly sleeping less than 7 hours a night and more than 9 hours a night was associated with an increased prevalence of hypertension. Regularly sleeping less than 5 hours a night was linked to a significant risk of hypertension long-term. 11. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. According to one clinical study, a time-release garlic extract preparation may have a greater effect on blood pressure than regular garlic powder tablets. One 2012 review noted a study of 87 people with high blood pressure that found a diastolic reduction of 6 mm Hg and a systolic reduction of 12 mm Hg in those who consumed garlic, compared to people without any treatment. If you find this video informative and helpful, please leave a comment below and don't forget to like and share it in your group. Thanks for watching.